part of the world, the number one condition is still coronary heart disease or coronary artery disease. This is a condition where the blood vessels of the heart are blocked as a result of a cholesterol plaque buildup in the arteries. Some patients will experience things such as chest pain or breathlessness when they exert themselves, and in worst case scenario, sometimes they get a heart attack and need to be treated immediately. So this is the number one number one heart disease, I would say, that is prevalent worldwide as well as within the region. There are also other conditions that's quite common. One of them is heart failure, the field that I mentioned that I was particularly interested in. In heart failure, this is actually quite a debilitating disease. Not very well understood, but people who have been diagnosed with heart failure actually have only a 50% survival at 5 years. Patients with heart failure, it could be as a result of the heart being weakened. It could also be because the heart is thickened and stiff. So they usually present with breathlessness, they present with leg swelling, and they feel tired. So this is also an emerging condition. In fact, close to 30 million people worldwide are afflicted with this disease, and it accounts for about 1 million hospitalizations per year to Europe alone. There are numerous factors that are associated with the development of heart conditions. We will say there are modifiable conditions, meaning those that are within our control. So these factors include obesity. We do know that obesity increases stress on the heart. And obesity is also associated with other cardiovascular conditions, risk factors such as high blood pressure, diabetes, and high cholesterol. So these risk factors eventually lead to blockages in heart arteries, eventually lead to heart failure. So these are often a result of poor lifestyle choices, such as a diet high in salt, high in sugar, high in fats. A sedentary lifestyle that is, with minimal physical activity is also associated with the development of heart diseases. And I think one very common risk factor in the region again is smoking. Cigarette smoking is one of the major causes of heart diseases, and we know people, smokers, are at a 2 to 4 times increased risk of developing coronary artery diseases. We do have a lot of skilled doctors, a lot of skilled consultants in Mount Elizabeth. Of course, with the know-how and with the surgical techniques and with the treatment techniques available. The hospital is also equipped with a lot of the advanced technologies, such as the artificial heart pump or the ventricular assist devices. They are readily available, and we've got the expertise in the Mount Elizabeth Hospital to perform the surgery as well as to take care of the patients after the surgery. Prevention is definitely better than cure. Even before developing anything, I think some of the active steps that we can do in terms of healthy lifestyle, I'm talking about things such as adopting a diet that's low in fats, low in salt, low in sugar, high in vegetables, fruits, and omega-3 fatty acids. These are the proven ones. We do know that a moderate intensity of exercise, about 5 times per week, 30 minutes each time, so that's about 150 minutes per week of exercise, has been shown to reduce the risk of cardiovascular diseases. In terms of screening, the main risk factors are diabetes, high blood pressure, and high cholesterol. So even at the age of 18 years old onwards, we generally recommend every maybe 3 to 5 years, everybody should consider going to their family doctor to have their blood pressure, cholesterol, and as well as the body mass index checked. And we recommend people to keep the body weight or the BMI to between 18.5 to 23.5. Above 40 years old, we should all go for about 3 yearly check at least of your blood sugar, because that's usually the age where diabetes can occur. So early active intervention for and detection of diabetes, high blood pressure, and high cholesterol. These are the cardiovascular risk factors. So for people who are keen to engage in high intensity sports above 40 years old, or if they have all these high risk conditions as diabetes, high blood pressure, high cholesterol, they should also consider going for cardiac screening when they are above 40 years old. And last but not least, again, I do want to stress the importance of stopping smoking for people who have already picked up smoking, because once you stop smoking, after about 10 years of stopping smoking, actually the risk of developing heart diseases drops back to that level of a non-smoker. So it's never too late to stop smoking.